Welcome to Cheddar Local Edition. I'm Brad Pomerance. We are joined by Roger Hernandez. He is a member of the California State Assembly. We are sitting smack dab in the middle of his district. We are in Irwindale, California today. Thank you so much for joining us.
Thanks for having me.
I want to speak with you about health care.
All right.
Broadly. As we know, the Affordable Care Act has passed, and in California seems to be fairly successful. Am I reading the tea leaves properly? Are you successful?
It has. We have insured close to 2 million people that were uninsured. No, actually, I'm wrong. Close to 6 million people that were previously uninsured over the last couple of years. So we have been doing really good in terms of making sure that people have a stronger, better access to health care. But we're not there completely.
Right. But why do you believe that the Affordable Care Act has been so successful in our state? What is it about our state, our residents, that has allowed this program to flourish, whereas in other states, not as much?
Well, California didn't resist. California was very much about enabling. So in my first 2 years in the legislature, we were very much focused on pushing legislation that was called enabling legislation.
Right.
It was legislation that anticipated Affordable Care Act rolling into our states, and we didn't resist. We didn't push back. We said, let's be ready. This is coming, it's going to happen, and it's going to benefit a community, a citizenry in California, where there's a huge gap in access to health care. A lot of people that are uninsured. So we knew we had to be ready and get ready, and we have led the state on just about the country on every marker, getting uninsured adults on board, getting uninsured children on board, but there's some gaps. And
let's talk about children, because that obviously, it's hard to deny whether you're in support of or against the Affordable Care Act, that we want our kids to receive accessible, affordable health care. The challenge is trying to get to those kids, and how do we get them into proper health care management? There is something known as the Medi-Cal expansion, and California did accept that expansion. We know it as Medicaid, Medi-Cal. How is that played in California as it relates to both adults and kids in your mind?
So the Medi-Cal expansion is significant because we know that it gives opportunities for yet a segment of the population that would otherwise, through your basic ACA, would not have been covered. So it speaks to youth that are at risk from not accessing. And so when we've rolled this out in the previous couple of years, we've noticed that there is a lack of information for some constituencies and communities throughout the state. Unfortunately, when you look at who's not getting registered and getting access.
Let's talk about that, because obviously you need to go to Cover California to access the Affordable Care Act, be it through Covered California's private insurance or the expansion. But we know that certain communities have been a little resistant to signing on to websites and interacting with the government. We know that children can't do that on their own. You actually were the lead sponsor on AB 2706, which focused at least on children, eligible, uninsured children. Tell us about that.
Well, let me tell you. So when we saw the rollout of Affordable Care Act in California, we knew that there was a segment of the population, adults and children, that were eligible but weren't being registered. But our significant concern was the fact that over 1 million California children were going uninsured, where 67% of them were eligible to receive these services.
Which is frustrating, because if they don't receive the services through Medi-Cal, they wind up in the emergency room, which is much more expensive for the state, for taxpayers.
Far greater state for the state of California, absolutely. So having the ability to make sure that they're accessing the services that already are available to them, they can access them because they're eligible for them, is critical. So we know where these children are at. They're in schools. The vast majority of them are in public schools. One of the state requirements throughout California is that first week of school, children are going back home to their parents or households with enrollment forms. My piece of legislation says that these enrollment forms will be accompanied with information that allows these families and their children to enroll through the ACA. We believe it's a better net to capture these students, these 67% of 1 million eligible, to get it registered and get access to health care.
And how has it gone?
It's going really well. The numbers are starting to increase in registration and enrollment there, and it's the participation from school districts, whether it's in San Francisco and San Diego and everywhere in between, we're seeing school districts coming on board. They're getting the information out. people literally from all over the state have been texting me screenshots of pictures they've taken of the enrollment forms of different school districts throughout the state of California, and it's pretty cool to see the school districts that are on board with this process.
Now, as you know, your bill was, that we just mentioned, 2014. In 2015, there was a very significant piece of legislation passed relating to children, and that dealt with undocumented children.
Yes.
They cannot be covered under the Affordable Care Act. That's federal law. But California is looking to expand its own state coverage to cover these undocumented children, not adults, but children. That starts next year. Talk to us about that piece of legislation. Is 2706 implicated in that?
Well, let me tell you, California has always had a history of providing health care for children. Immigration status has never been an issue.
Right.
Unfortunately, with the coming of ACA, one of the compromises that the Obama administration had to have with the Republican majority was that the care for undocumented children was going to be stricken out. That was going to be a change, contrasting what most states, most of California was already doing, particularly LA County. LA County has always provided health care for children where immigration regardless of status. So what this piece of legislation has done this year has been to basically cure that gap that was created by the coming of ACA. And because California leaders want to continue providing for children, we believe that's our best investment.
So in the background of all of this, though, as you know, there had been a tax on Medi-Cal managed care plans that the federal government deemed impermissible. And as a result, this summer, you and your colleagues were in special session to focus on trying to modify the tax so that it will apply to most plans. It's complicated. We don't need to get into the weeds on this. But what we do know is that the special session on health care and on transportation, let's just say they're still going on because not much came out of them. And so talk to me about the special session. You can focus on healthcare if you'd like, or transportation generally, or why is it that we're still talking about this and nothing happened at a special session?
Well, I think there's a spectrum of viewpoints in the California
legislature.
Yes, there is. California is the most diverse state in the union, and this legislature reflects that diversity in the way we think. Democrats don't all think alike, and Republicans don't all think alike. There is extreme points in both ends of the partisan spectrum, and when you combine both Reaps and Dems, that spectrum is even a broader one.
But it becomes it puts the state in a real pickle, because this tax on exclusively Medi-Cal managed care plans, it's going away. Federal law is requiring that it goes away. When that happens, we got a big old hole that's going to cause some significant problems, and one would think fiscal prudence, I'm not trying to take a position, would dictate that we make this fix.
Right.
You know, and
well, whenever resources go away, there's a gap, and that gap affects communities adversely generally if services are rendered from these dollars. When Arnold Schwarzenegger was running for office, and he said, as part of his campaign promise, was that he was going to cut the vehicle license fees by 2/3. But what did he do? And people were excited about that. But what he didn't tell the citizenry was that those dollars were paying for police and firefighters on the ground. And so we subsequently saw the layoff of many public safety services. So do you anticipate, when you all go back at whatever point it is, that the special session and the goals of the special session on health insurance will be revived? Oh, undoubtedly. Health access is a significant concern for the legislature. I think for us it was, we weren't going to be able to get it done in a special session because most people agree with this issue, that the deliberation has to be lengthy. I hear you. His name is Roger Hernandez, member of the California State Assembly. I'm Brad Pomerance, Charter Local Edition.